Okay, welcome everyone. First of all, I just want to say thanks to Hope Street Youth and Family Services for giving us this opportunity to evaluate the program and being part of it. It's been a great experience and we've really enjoyed it. You're a great organisation to work with and you've given us great access to data and great communication, so thank you. I'd also like to thank all our the funding partners and support we've had and all of the partners involved in the project. Without them, it wouldn't be possible, so thank you. Now, I'm going to start talking about the findings of the report, so hopefully you've got a copy of it. And then at the end, we'll have some questions, and Daniel's going to help and answer some questions as well. But if you have any concerns or questions as we go through, feel free to ask me. So to start off with, just going to set the scene in terms of the context for Hope to Home. So I'm not sure if people are familiar with the latest census results that just came out. So in 2016, there were more than 116,000 homeless people in Australia. Looking at that from the 2011 census, that's an increase of 5%. So in essence, it's going with the rate of population growth, essentially. And the increase in numbers from 11 to 16 is basically due to an increase in severely crowded dwellings. So that's why there's been an increase. And of course, young people are predominantly involved in those houses, those unacceptable situations. And nearly 60% of all homeless people are under the age of 35. So in the Australian context, homelessness is a serious problem, and particularly for young people. And given that, and I think a lot of you would remember this, the 2008, I think it was called the Road to Home. The federal government promised to halve homelessness by 2020, and yet here we are in 2018, and we're plateauing at best. So obviously there's a need for programs like the Hope to Home, and also looking at the Melton and Whittlesea local government areas, they've experienced great population growth, have a lot of young people and have a strong need for housing services. So that's just the context of a little bit of the context there. So I'll start off with going through the report with basically an outline of who the young people were. So in total, there were 72 people, 45 young people and 27 dependent children. And I think, am I right in saying that surprised everyone, Donna? Yeah. How many dependent children were part of the program, and it was a great thing. Average age of 20 years, and they really were a diverse background. So we had young people from different ethnic backgrounds, different family situations, different living situations. It was really a diverse group of people. About 60% were involved in some form of education, and about 50% were employed during their tenancy. So incomes were obviously on the average, quite low. And so obviously it's quite a difficult thing for those people to secure and maintain tenancies. So in total, Hope to Home had 31 tenancies. And I'm just going to show you some figures now about the young people and the tenancies. So they're the numbers in Melton. So the blue is the young people housed and the orange is the accompanying children. So you can see that they're over 30. There's 31, correct me if I'm wrong, Daniel. 31 and in total about 50, I think it's 54. But quite a lot of accompanying children in Melton and less in Whittlesea. Whittlesea started a lot later than the Melton program, so there was less total numbers in the Whittlesea rollout. Here are the tenancies, and and in relation to children. So you can see quite a lot of one-child and two-child tenancies, and some no children tenancies in blue there. And looking through this chart here, you've got single occupancies. The orange is Whittlesea, the blue is Melton. So you can see from this that it's quite a diverse range of tenancies, quite a lot of two children and one child setups. Probably, slightly unexpected, because you would think there'd be a lot more young people sharing accommodation and single occupancies, but there were a lot more families than we thought. And looking at how the young people entered the program, you can see here that the largest group were couch surfing or staying in unsuitable accommodation temporary accommodation with family, friends, etc. Transitional housing, a few in private rental and Hope Street units, and some sleeping rough. So a very, very diverse range of situations prior to entering the program. Okay, so getting on to the findings. So as I said, there were 72 people housed, so that was more than expected. So the program was a success on that level. I suppose was the primary goal, was to get people housed, and it did that. There were 31 tenancies. And in regards to the suitability and affordability of that accommodation, more than 70% of clients were happy with it. And I think that's a really good number, considering low-income young people, for more than 75% to find the accommodation affordable and suitable was a strong finding and strong evidence supporting the program. So I should mention also that the findings that we're presenting were based on 26 qualitative interviews. I think 17 of those around were young people, Daniel, yeah. Also service user data that Hope Street provided us, and we also we had an online survey, and we had 79 responses from the young people. So we had that triangulation of data points. We had the qualitative interview, quantitative data as well. So the findings are bringing all of those data sources together. In terms of what the clients thought of the program, I think there was overwhelming support. I would describe for the program. Everyone we spoke to and the questionnaire responses that we've got suggested the young people found it fantastic. There were very few, if any, negatives. There were some suggestions for improvement, but the young people really enjoyed it. Some of the main themes that came out, young people were quite surprised at the broad range and the flexibility of services. They said things like, I couldn't believe that, my car broke down, I couldn't get to work, and Hope to Home fixed my car for me, and just couldn't believe a service would do that. They're quite shocked. Support from case managers. They loved the case managers. They spoke glowingly about the work they did and how supportive they were. And they also talked about how difficult they had found it trying to secure private rental accommodation and the rejections that had over and over again, and that how Hope Street, in helping them through that process, both in the co-signing of the lease for 6 months and also with the liaising with and also the partners of the program, they found that really, really helpful. And then there was a learning process with that as well, where the young people had that experience of getting a private rental accommodation once, and therefore felt like some of them did do it on their own after that. But they certainly, there was a learning in regards to securing and maintaining tenancies that they reported as valuable. And again, some of those things they didn't expect from the program. They just thought, oh, here's another program helping us. You know, we hope it turns out. And then they found that it was much more than they expected. Okay, so some of the qualitative quotes. I feel like the project benefited people. It's still one of the best things that has happened to me. It makes you want to get out of this. It kind of encourages people to do something on their own. Anything for my kids, we get it. They've always been a big help. She came over after I had Bubs and bought flowers out of her own money. She's just a lovely lady. So that's the sort of qualitative feedback we had from the interviews. Okay, this is some of the survey data in terms of suitability. How safe do you feel in the property that you're in? So these are the Hope to Home tenancies. So you can see there, overwhelmingly very safe. How easy is it to get to services you need? Again, very easy and easy was a dominant response. And I think that has to do with Hope to Home providing services in young people's neighbourhoods. By bringing the service to the young people, obviously they're close to their friends, their family and education and work. So that's a big, that was a benefit of the program that was reported. Again, they're the suitability numbers. So again, mostly highly suitable and suitable, and affordability. So only a few said their accommodation was not affordable. And again, I think with the Hope to Home gave people starter kits for their tenancies, helped them and gave them cash brokerage and vouchers along the way, and continued to support them throughout the tenancies, which I think was reported as a positive thing, rather than just, here you go, now see if you can do it on your own. Okay, so some of the unique factors of Hope to Home and things that we highlight in the report, that it supported Whittlesea and Melton growth corridors in Melbourne, which is one of the first programs to do that. As I said earlier, there's a strong need there, so that was unique. That it provided ongoing service for clients to maintain tenancies, so I think that was a very important thing. The number of dependent children housed was surprising and you know, a positive finding. And the co-signing of tenancies for 6 months was, you know, from what was reported, it appeared to get a lot of tenancies over the line and help people find tenancies. I think was it 5.5 weeks, the average time, Daniel, do you remember? Yeah, I think it was. Yeah, 5.5 weeks was the average time to get from being accepted in the program to finding a tenancy, and also there was a 70% acceptance rate from referrals into the program, so most young people were accepted. There were a broad range of reasons for people not accepted, like moving, I think, a lack of income to meet the eligibility criteria, disabilities. There was a broad range of reasons why they weren't accepted. And I think the last point there is, for me, for us, the most important thing, uniqueness about Hope to Home was that it had a broader community impact through partnerships. And I think that's a key issue. I think whenever you address any issue, societal issue, community issue, if you can look at the individual, the relational and the community levels, then you will have lasting success. If you only address one or two, then you will have less success. And I think as Donna said before, and it was shown up particularly in the interview data, that by building partnerships, you can imagine you're reducing stigma, you're developing relationships between the young people and members of society, developing relational skills, and you're tackling homelessness at those multiple levels. So you can imagine a bigger rollout of this model, having what we call ripple effects that become, torrents. And then more and more people become aware of the problem, have more contact with young people in these situations, have more empathy, less stigma, and we can, I think, address this serious problem in a better way. So I think that was, really what was unique about Hope to Home. Some of the ways to improve the model that was suggested from the data. Broadening the capacity, obviously it was a limited number of young people accepted and limited funding, so a broader... the case management component was so well received by the clients, but yet there was only 2 part-time case managers, and clients said things like, well, what happens at Christmas when they're on holidays and I need something, my needs don't get put on hold. So things like that. So I think that in a rollout and a bigger rollout of this, there needs to be a greater case management component. Increased or more flexible brokerage, even though there was brokerage and it was to some degree flexible, the clients wanted a bit more, and sometimes would have liked more cash for particular needs. And obviously the fact that the 27 housed dependent children was a surprise. Obviously, Hope to Home did its best to cater for them and those families, but in a broader rollout, I think more attention needs to be paid to that. So I think, have I missed anything, Daniel?
No, you covered it really well.
Yeah. So any questions? Yes, yeah.
I'm coming around here.
Yeah.
I'm just curious to know whether or not there was encouragement for the residents themselves to have much to do with one another, or did they maintain the relationship mainly with the case manager?
I don't think...
A few of the tenancies had more than one person participating in the program, so obviously they were bound together. But, there were a series of skills workshops and other things that helped them kind of learn skills together, so that I guess they could draw on their resources. And Hope Street obviously do a good job with their case manager, their community integration facilitators pulling people together where there are common needs. So there was additional support provided in terms of workshops, life skills, those sorts of things.
It's a good point, because it actually was one of the clients said, who had children, said it'd be great if there was some organised social activities with other young people and other families, similar people. They called for that. Yeah. Yeah.
With some of your data,
Yeah.
from page 35 onwards,
Yep.
you've got things like how would you rate the suitability of the current living arrangements. You've got
Yep.
unsure, unsuitable, highly unsuitable.
Yep.
Did you actually drill down to work through what that actually meant? And there's other measures like safety, feeling unsafe.
Yeah.
So the vast majority of the residents were fine with what was their situation, but
Yeah.
but some of this other data, I suppose if that was drilled down, and then any recommendations from that?
It was drilled down in the qualitative interviews, but we didn't. Nothing really came out in terms of the few people that had. You're talking about the people who had unsuitable, what that was and why it occurred. It didn't come through in the qualitative data. So in essence, the survey was unable to capture it, and in the qualitative data, it didn't. We asked, but it didn't come through, and it may be because those few people weren't part of the interview group. But again, something we could follow up and actually target those people whose accommodation needs weren't weren't met and ask why. Yeah. Yeah.
I think I read up there was 60% of the homeless are under 35.
Yeah, that's right.
What's
Yeah.
do you have a percentage or a value for under 25?
I do, and I think it's in the report. It's about.
In Victoria? So with
It's about. I think it's 35 from memory. Around. Is it 39? Is it?
Census, 39% of the total number of people who are homeless are young people under the age of 25. Yes.
Any other questions? No. Oh, yeah.
Work done in terms of reconciliation or with the family, connection. Like, was there an emphasis on that as family connection?
Not in the data, but yeah.
Yes, yeah, there certainly was with the model. So looked into Hope Street's Youth Reconciliation Program, so that which is our counselling program. So if young people wanted to rebuild relationships through that service that they could. Also, it might have been through Reconnect within the local community that offered through the Melbourne City Council. And just by being in the local community, staying in the neighbourhood where their families are, young people could choose about how that relationship operated. Like, so whether it was a half-hour visit, or whether it was catching up with them for a coffee in a local shop that they knew, were familiar with. So it was basically remaining in their neighbourhood, as Peter said, enabled that to happen, but more, I suppose, in a way that the young person is feeling safe and where they're determining how that occurs was a key factor. In terms of John's question, I think drilling down to why other accommodation was not suitable. Certainly the feedback that our workers are getting from young people is that about it being unsafe accommodation, extremely short term, that they couldn't actually secure tenancies that were beyond a few weeks sometimes, that they might have already been in tenancies with, for example, transitional housing but had to be out. Couldn't afford the rent. So it was a combination of things, but safety and security and affordability of tenancies. Overcrowding was another one. In fact, a young person makes a comment on that in the report. So those were some of the factors drilling down into their accommodation not being suitable.
Yeah.
Just a question about checking in with these young people in the future. Like, is there any measures that you're going to do about whether they get a second tenancy without any support, or what the sort of long-term data will be from the evaluation?
There was some information from the case managers as to that. It was less formal, telling us that that client is now not in the Hope to Home tenancy, but they've found their own tenancy. So there's a couple of those, yeah. Yeah.
Can I also add with that it's really important that our approach with young people, so we know that like most people, your life sort of goes like this. You've got highs and lows in your life where things are good and then something might happen and it goes like this, it can plateau. So it's really important that when there are those situations where young people feel that they require some assistance, even if it's a phone call to someone, that they can actually contact that worker again without having to go through the bureaucratic process of trying to put in an application and be assessed and so forth. So once that relationship is there, an important part of this model is that a young person can contact that worker again at any time. The relationship between the young person and the worker is critical, and young people talk a lot about that. They talk about how that's a really important factor, and it makes sense because it's the face-to-face, human-to-human contact of we're here for you. Your well-being is paramount to us. What can we do? And young people need that. They need to know that someone's on their side.